right, thank you everyone. My name is Patrick Kelly and I'm a fourth-year PhD candidate at the Brown School of Public Health. So diving right in, this work was funded by the National Institute on Drug Abuse and is part of my dissertation work, which is to create a machine learning algorithm that could predict if someone has been exposed to xylazine based off of the contents of their medical record. And I want to thank the people of the Kensington, Philadelphia neighborhood whose experiences and insights inspired this work. And I'd also like to thank the healthcare providers who participated in my research. So xylazine, which you may have also heard called tranq, is a veterinary sedative used to adulterate the unregulated fentanyl supply in North America, especially along the east coast of the United States, which is where I'm from. Xylazine is associated with three key health harms. The first that I'm going to note is that xylazine causes prolonged sedation, which has implications for how xylazine and fentanyl-involved overdose is reversed. Second, xylazine is believed to have vasoconstrictive properties that are associated with the development of skin wounds, which can appear away from injection sites and even among folks who are not injecting their drugs. These wounds can become severe and life-threatening if not treated. Third, xylazine-fentanyl combinations are associated with what people who use drugs have described as withdrawal that is worse than opioid withdrawal alone. And so to understand emergent treatment practices for xylazine exposure, I conducted 12 semi-structured interviews with healthcare providers who treat people who've been exposed to xylazine to understand organizational capacity for xylazine toxicology screening and clinical management of xylazine-related health harms. And so there were 6 key thematic findings produced from a rapid qualitative analysis. The first of which is that limited drug surveillance obscures xylazine's prevalence in the drug supply. The second, xylazine exposure is inferred by clinical presentation, rarely toxicology screening. The third is that respiratory support and monitoring are essential when responding to xylazine-involved overdose. The fourth is that wound chronicity, limited treatment guidelines, homelessness, and stigma complicates xylazine wound healing. The fifth, withdrawal from xylazine dependence typically co-occurs with opioid withdrawal. And the sixth, xylazine may be worsening experiences of precipitated withdrawal when inducting onto buprenorphine. And so these things really speak to the complexities of care coordination to manage xylazine-associated health harms. And I also want to note that the high level of care coordination that's needed for xylazine exposure is a result of the unpredictable drug supply and the complexities of care that are needed to help folks. And this will only worsen as new adulterants like medetomidine are infiltrated into the drug supply, which we're continuing to see happen in Philadelphia and up in Boston. So I know that was extremely quick. If anyone has any questions or wants to connect for further information, please do reach out. I appreciate it. Thank you.